I'm Dr. Danny Clark, Director of Orthobiologics here at the Protea Performance Center. And I want to talk about low back pain, specifically when that low back pain is related to painful facet joints. So, your facet joints are the joints in the back part of your spine or the posterior aspect of your spine that connect that part of the spine and it allows for movement, rotation, bending forward, bending backwards. A common symptom that people have with facet related pain is the bending backwards. So, what happens when you bend backwards with irritated or arthritic facet joints? Those joints get kind of compressed together and rub up against each other and can become painful. So the traditional approach to facet related pain is that they'll go in, they'll numb on two separate occasions the nerves that communicate the pain signals from the facet joints to your brain. And if that relieves your pain, they say, okay, great. Well, now we know that that facet joint is painful. But instead of addressing the actual facet joint itself, I mean, sometimes they will put some steroid in the facet joint, but most of the time they'll do what's called an RFA or a radio frequency ablation. Essentially, what they're doing is they're putting an electrode in there that is burning or killing the nerves that are sending those pain signals from the facet joint to your brain. The analogy I like to give my patients is if your house is on fire, that's like unplugging the smoke alarm because it's annoying instead of putting the fire out. Our goal is to actually inject something like PRP or stem cells into the facet joint itself because that's where the fire is, that's where the pain is. And we want to try to calm that down, make that tissue a little bit more healthy, and reduce the pain at the source. We also, while we're doing this, we always include that full functional spinal unit where we're treating the multifidi or the supporting muscles that stabilize the spine because an unstable spine is going to cause those joints to press up against each other more and cause pain. We also address the ligaments around there. So that's the interspinous and supraspinous ligaments, also responsible for stabilizing the low back. And then also the iliolumbar ligaments can sometimes be involved as well. Really the whole goal here is to one, put the fire out, and then also build a healthy structure around it so that that excess movement is no longer contributing to that pain. Now we also do like to address the nerves, but we're treating the nerves, we're helping those nerves heal rather than just killing them, because when you kill them, eventually they're going to grow back, and they're going to grow back in a more dysregulated way and potentially become more painful. And so over time it's going to work less and less and less, and our goal is the opposite. We're trying to resolve this pain and ultimately see you less and less and less